My name is Adeni. I'm 15 years old. I have a vascular necrosis. I've been told that I might need a hip replacement soon. The Sickle Cell Center will help provide me with a strong support system.
As a parent, I have been empowered to advocate for my child. By supporting the establishment of the Sickle Cell Center, you are providing improved care for our children.
Scago gave me a scholarship, plus an opportunity to work with the youth. This was good because we had good rapport, plus we thrived off each other's experiences.
Scago also gave me a scholarship. The Sickle Cell Center will provide social and psychosocial research in sickle cell disease, which is pretty awesome, support groups, and genetic counseling for individuals with the trait, with the disease, and their family members. The center will also connect the community with primary and tertiary caregivers. So, you know what I'm going to say, support the center today by donating. Pledge forms are available at your request. And remember, Scago is a not-for-profit charitable organization, and all donations are tax deductible. Thank you.
Member from Barrie.
Thank you, Speaker. I recently had the opportunity to meet with representatives from the Sickle Cell Awareness Group of Ontario and the Thalassemia Foundation of Canada. Thanks to these representatives, I learned more about sickle cell disease and thalassemia, two diseases which attack the red blood cells. Healthy red blood cells are essential to health, as these are the cells that provide oxygen to the body. When red blood cells aren't healthy due to sickle cell disease and thalassemia, it can lead to everything from pain to infection to diabetes, heart failure, or even organ damage. Thankfully, with regular blood transfusions, proper treatment, most people suffering from these diseases can be treated effectively and with relatively little cost. Yet there are severe gaps in our healthcare system which act as barriers to care for people suffering from these diseases, meaning that many people who suffer end up with emergency rooms across the province due to complications from their illness. Even worse, often when they arrive in emergency rooms, they have to be transported to hospitals with teams who know how to deal with complications arising from these diseases, and this is costly to the patient and to the province. The problem is that Ontario lacks a coordinated, comprehensive healthcare strategy for people with these diseases, and the need for a provincial strategy is made even more urgent given that sickle cell disease and thalassemia are the most common genetic conditions in the world and are emerging as significant problems right here in Ontario. This is why I urge my colleagues from all sides of the House to support the creation of a provincial strategy for sickle cell disease and thalassemia, and together we can ensure that Ontario's healthcare system is one that we can be proud of, one in which every Ontario citizen can receive the care they need and deserve. Thank you, Speaker.
Thank you, Member Stevenson. Member.
My name is Dr. Richard Ward, and I'm the Medical Director of the Sickle Cell Program at Toronto General Hospital, the largest of its kind in North America. I support comprehensive care for sickle cell disease in Ontario.
My name is Jean Augustine, and I support comprehensive care for sickle cell disease.
My name is Doreen Alexander. I'm the president of Sickle Cell Awareness Group of Ontario. I support comprehensive care. Without comprehensive care for sickle cell disease patients, we will lose many lives. Comprehensive care for sickle cell patients is a necessity.
Hi, I'm MPP Mike Cole, and I'm here to implore you to support comprehensive care for sickle cell across the province of Ontario. Please support comprehensive care for sickle cell.
I'm pleased to be here to represent my colleagues in the PC caucus. We understand how important this is, and we understand that this is one of those secret diseases that very few people know about. There's not very much profile about it, and I want to thank you for today.
And this is a long-standing health issue, a very effective argument on the part of early intervention and prevention. There's a strong financial argument for more compassionate care, for a registry, for testing.
The Sickle Cell Center will provide social and psychosocial research in sickle cell disease, which is pretty awesome, support groups, and genetic counseling for individuals with the trait, with the disease, and their family members. The center will also connect the community with primary and tertiary caregivers. So, you know what I'm going to say, support the center today by donating. Pledge forms are available at your request. And remember, Scago is a not-for-profit charitable organization, and all donations are tax deductible. Thank you.